I'm Dr. Guy DiMartino. I'm a personal injury and medical malpractice lawyer. Today I'd like to talk about medical malpractice cases involving the failure to timely diagnose a subdural hematoma. Big words, what is it? This is the typical story in the cases that I've been involved in. Somebody has been involved in an accident where they rattle their cage. They hit their head. It could be a car accident, it could be a fall, it could be a freak accident, it could be somebody who's hit with a softball or a bat or things along those lines. They go to the emergency room. Oh, let me back up. What is a subdural hematoma? What is the DURA? Well, the central nervous system is comprised of two parts, the brain and the spinal cord. The brain and the spinal cord have something that covers them, and those are called meninges, or the covering. The inner meninge is called the pia mater. The middle part of the meninge is called the arachnoid mater. And the outside, or the outer covering, is called the dura mater. And in the Latin, that means tough mother. So it's fibrous and it helps protect the spinal cord. Now the arachnoid area has a lot of blood vessels in the area. So what happens is that the cage gets rattled, a blood vessel might burst, and you start to leak blood, and pressure builds up between the arachnoid space, the arachnoid mater, and the dura mater, and you cause a space-occupying lesion which can grow in the brain and cause pressure and obstruct the flow of something called cerebral spinal fluid. So that's what a subdural hematoma is. So this person goes into the hospital or sees a doctor, the doctor evaluates them, the patient's complaining of a headache, the doctor does not do a CT scan, which is a CAT scan, to take a look at the brain to see if there is any bleed or any change in fluid balance in the brain. The person is discharged home. A day or two later, they're found on the floor unresponsive. They get taken to the hospital, a CT is done. They see this hematoma in the subdural space. It's pressing on parts of the brain, and then it needs to be evacuated, and the person might end up with brain damage, or the person could die. That's the typical scenario that I see. See, the standard of care requires that an emergency room personnel or an urgent care center doctor order a CAT scan if somebody's complaining of a headache and somebody has had some trauma to their head. If you have any questions about failure to diagnose a subdural hematoma, you can always give me a call, shoot me an email, or visit my website and blog. It has a lot of great information. Thank you and have yourself a great day.